When you're treating the elbow, the most common problem you're going to encounter is an unstable elbow, not a stuck elbow. Yes, you'll work on the radius once in a while. Yes, you'll work on the ulna, but mostly this joint becomes unstable from falls or overwork or repetitive strain. So what happens is you have to think about Beighton's test, and if you haven't learned Beighton's test, B-E-I-G-H-T-O-N-S, they're tests that tell you if someone has systemic hypermobility, which could be hypermobile or it could be Ehlers-Danlos or Marfan's. But you're going to find this joint is very commonly unstable, and I'm going to show you how to fix it. So now we're going to test the stability of the elbow, and this is very important. We talked about how you can mobilize the head of the radius and how you can flex and extend the elbow joint, but this is very important. So I'm going to grab either side of the elbow and I'm going to move it lateral to medial, and there's very little movement. That's a very stable elbow. And now we'll go to the other side, and on this side you can see that it's floppy. That's an unstable elbow. I'm just moving it lateral to medial. So what we do is we want to put some tape on that. So if you don't mind, keep your arm in that position. We want to stabilize both sides by putting a little tape on that. And so I put some coverall stretch on this because I find that the other more elastic tapes are a little bit too stretchy. And my patients will just wear this for many weeks until it stabilizes, and over time it will stabilize, especially when I put laser in the joint. And if you go to the laser section, I'll show you how to use laser on this joint and actually strengthen these ligaments. But this is a great way to protect someone so they can exercise, whether they're going to ride their bike or do Zumba or whatever, and they're not going to hurt themselves by putting tape on both sides of the elbow, which will then make it far more stable.